Ogden Surgical Medical Society, the continuing education conference. I am delighted to see so many people here. And we are trying to do our best to prevent people from coming here. So just be patient because a couple of doors on the north end and the east end are still closed. So I expect we'll get more people and I expect this place will be full in about 10 or 15 minutes. But I thought I'll kick things off with just a few welcome remarks. It's a real pleasure to host this conference. I'm always thinking about continuing education, professional development. And this is one of the things that we tell our students, that it's not just about learning in these 2 or 4 years or 6 years. A lot of this is about actually understanding the concept of lifelong learning. And so it's a real pleasure to see this come to fruition from your perspective, as well as considering that you are in a discipline which is constantly evolving, constantly changing with the advent of technologies like generative AI and so on. I definitely want to make a plug for our wonderful 2 colleges that are going to be featured here this morning. College of Health Professions, which has a lot of health-related programs, and College of Science. Both these programs produce a lot of graduates who actually work for you, work with you. Our 2 programs also produce a lot of pre-med students. So, I hope we can continue this relationship. I encourage you to be actively involved, actively engaged with these 2 colleges. And, and I think it's mutually beneficial as well. So with that being said, let me just say that welcome again. I hope you have a great conference, and I hope it's fulfilling from a professional development perspective. I do know that both our Dean Yas Simonian and our Associate Dean from the College of Science as well, they have great presentations. I'm looking forward to all the good things they're going to say. Thank you.
Thank you, Dr. Crovey, for doing that for me. I got here a little bit late. I'm Kirsten Baca, president of the conference this year. And I just wanted to take this moment to thank our partners sponsoring today's meal, this breakfast. Dean Yas Simonian of the WSU Dumke College of Health Professionals, and Associate Dean Barb Trask of the WSU College of Science. And let's see, are they speaking this morning? Oh, there they are. Thank you. Thank you. All right, I will get out of the way and let them speak. You guys move so fast.
Good morning. Are we awake? I'm barely. I live in Holiday, and I had to get up at 4 o'clock, and I'm a night owl. So, but it is a great pleasure to be here because we appreciate all the things you do and all the opportunities you give our students. Both of our colleges really need you. And hello, Dr. Johnson. Yeah. And welcome. I know, I think we need to talk to Teresa and come at lunchtime when there are more people, but the important ones are here. So there we go.
So thanks for inviting us to be here this morning. As Dr. Simonian Yas said, it might not be early for clinicians, but it is for educators. So, despite the hour, we're glad to be here this morning. I'm Barb Trask. I'm the Associate Dean of the College of Science, also faculty in the Department of Zoology, and I did serve as the university's pre-medical professional advisor for 13 years. Stopping filling that role in 2020. So I know a lot of the students that both Yas and I advised are going to be out in the audience later today. Today we'd like to share some information about some of our very special students who are pursuing degrees in our respective colleges. Both of our colleges work with future clinicians that will work with all of you. We'd also like to share some ways that we have and hope to continue strengthening the support we give our students through the connections that we have with all of you. And then finally, we're going to do a little bragging about our students and our programs. So should we get started?
Yeah.
We're going to show you a couple of short videos about some of our inspiring students.
Allie's trying to make it go.
Yeah.
There we go.
Your voice really matters here at Weber State. Everybody's always listening to what you have to say, and I think Weber State's a great environment. My name is Trini Gonzalez, and I'm getting my degree in medical microbiology. I chose Weber State because they are always willing to work with my family and my personal schedule. I have 2 beautiful children, an 8-year-old son and a 1-year-old girl. I became a father at a young age of 17. It frightened me. I wasn't quite sure if I was ready for that responsibility. And so what motivated me was I wanted to give him more than what I was given. Microbiology is one of the many majors that pre-med students take. I plan on applying to medical school this cycle, and so that's sort of what's on the horizon for me. I think my son is going to truly admire all my accomplishments and everything that I've done to be able to provide him and his sister a better life. He's going to think, wow, my dad can do it. My dad did it.
I always knew that I wanted to do something in the medical field. And when I heard about Weber State's Medical Laboratory Science program, I was just kind of drawn in by it. I had been having neck pain on and off for 2 years or so. I was in the middle of my semester in hematology, and I found out that I had a 5-centimeter tumor in the middle of my skull. You never think that that kind of thing is going to happen to you, especially when you're in your early 20s, like supposed to be relatively healthy. Because of the positioning of the tumor, the easiest way to get it out would be to separate my jaw and tongue in 2 so that they could go through the roof of my mouth to get the tumor. I also had my spine fused together as the tumor had eaten away so much of that bone. All I wanted when I was in recovery was to be normal again, to have the opportunity to work, to have the opportunity to go to school. I currently work as a generalist laboratory technician for Intermountain Medical Center, which is actually the hospital that I had my surgery at originally. I am so excited to be here. And sometimes it hits me really hard that I actually got to be this far, and I didn't expect to be this far before.
So, as you know, connections with professionals in the community strengthen our students' abilities to succeed. Both of our colleges have enjoyed the community relationships that we have, and we hope to continue building them as we move forward. Just a little bit about the College of Science before we talk about how we might continue to build those relationships. Is the College of Science has 6 departments and 7 degree programs. As our students, Trini said, we have microbiology, where a lot of our pre-professional students tend to migrate, as well as zoology, and biochemistry are the major programs that our pre-professional students choose. In addition to that, we have botany and geosciences and physics. I'll let Yaz talk about the programs that her college supports.
All right. Our students have to take chemistry and physics and biochemistry and all sorts of courses from College of Science, and we get along really well. We help our students. It's important for us, for them to succeed, and they all need your help. The clinicals, rotations are in clinics, in hospitals that you're at, and we have gotten this far, especially in our college all these years. I think we celebrated 72 years of in existence. We have programs, we have 10 different departments, and 2 of them are schools, and 8 of them are different departments. We have athletic training, which houses rehab science, emergency healthcare, health sciences, which is the foundation. We have nursing, radiologic sciences, dental hygiene, health administrative services, medical lab sciences, physician assistants, which I'm proud to say our first cohort of PAs will be graduating this December. And we just accepted in January the second cohort, and they're doing great. They're doing the white coat right now. They're in your places doing their rotations, and we're happy to have you host them. Thank you so much. And we have respiratory therapy. Those are the 10 different areas. This flyer with all the different, I'm doing Vanna White, with different programs are at a desk outside with our colleges. So you can check that. One of the things, other than all the pre-med that we have our students, we have had so many students graduate in pre-med and pre-dent, and a whole bunch of PAs. And one of the things that we would like is for you to say you want to be preceptors. We have a great need in general surgery. We have cards that you can fill your information out in the front, right? Under the College of Health Professions and under College of Science. And guess what? We have drawings. We have good stuff to give away. So please check in and write your names and do the cards. The PA's PA booth has more information regarding preceptor and benefits and stipend for that. So that happens too. So we will be happy to help you with that. And it's important. Okay, Barb?
Okay, thanks, yes. So I guess I just want to clarify that there are, what we see are the ways that we can continue to build our relationships is, first off, the previous slide said we have an open door policy, and of course our doors are open, but our minds are open as well. We want to hear your experiences with the students that we send your way, because we want to know how we can improve the support that we're giving our students. In addition to the clinicals and the mentorships and the shadowing and the preceptorships, which provide our students with firsthand, in many cases, firsthand experience in the clinics, they can apply to the programs that they're trying to get into with some experience in the field, and you all can help us do that. But in addition to that, if you don't want to take someone under your wing through a clinical to oversee their clinical experience or their shadowing experience, you could maybe offer to do a guest lecture to those to some of our students. Sometimes those guest lectures are just talking about what your professions are like, and in other cases, those lectures are providing some sort of clinical information to our students, especially in Yaz's college, and you can earn some CE credits for doing that, those sort of clinical presentations to our students. So those are the ways that we can hope to build the relationship between you guys in the field, so to speak, and us here preparing students to enter that field. So that's a bit of information, I guess. Now the fun part of all of this is bragging. So I'll let Yaz brag about some of the students that her college produces.
Do we have any Wildcats, people that went to Weber State? Yay. Okay, great to see you all. Thank you for raising your hands. And do we have people doing guest lectures for our college, for both of our colleges? Well, it's your opportunity now. Yeah, we need to change that. So we'd like to see that. But these are all of our accolades. Look, I mean, there's not enough space to put all of them in. We're very proud of our programs, our graduates, what we do, the awards that we get. Scott just got an award for community involvement, and Dr. Moore, I should say. So we're doing great, and we can't do it without you. So please open your doors. Our doors are, our minds are open, as Barb said, but we'd like you to help us out too. Thank you.
I think
That's it. Our time is up. Thank you.